Hello, welcome to Virtual Learning Hub's presentation on equality, diversity, and rights in health and social care. My name's Jasmine, and I'm glad to be able to present this to you today. At the end, please could you remember to like, subscribe, and share this video to anyone that you feel that it may be useful for. So we're going to look a bit closer into equality and what that means. I'm going to show you a quick video on the protected characteristics that work in line with the Equality Act 2010. And this has been kindly shared by the Equality and Human Rights Commission.
The Equality Act 2010 protects us all by making it against the law to discriminate against or harass someone because of a protected characteristic. We all have more than one of the 9 protected characteristics. Age. You must not be treated less favourably for being a particular age or within a range of ages unless the treatment can be justified. Disability. If you are disabled, the Equality Act protects you from discrimination. It also requires employers and service providers to make reasonable adjustments to address the disadvantages you might face. Disability includes long-term illnesses that affect your normal day-to-day activities. Certain conditions like cancer and multiple sclerosis are automatically classed as disabilities. Gender reassignment. You must not be discriminated against because you are transitioning or intend to transition from your sex assigned at birth. To be protected from gender reassignment discrimination, you do not need to have undergone any specific treatment or surgery. Marriage and civil partnership. You must not be discriminated against at work because you are married or in a civil partnership, whether your partner is of the same or the opposite sex. Pregnancy and maternity. The Equality Act protects women from being discriminated against because they are pregnant, including due to pregnancy-related illness or if you are a new mother. Protection from discrimination at work extends to the period of maternity leave. Outside of work, it lasts for 6 months after giving birth. Race. The Equality Act protects you from discrimination because of race. Race means your colour, your nationality, your ethnicity, or national origins. A racial group can be made up of more than one distinct racial group, such as Black British. Religion or belief. You must not be discriminated against because of your religion or belief, or because of a lack of a religion or belief. Generally, a belief should affect your life choices or the way you live for it to be included in the definition. Sex. Sex refers to being a man or a woman. You must not be discriminated against because of your sex. Sexual orientation. You must not be treated less favourably because of your sexual orientation, whether you are attracted to your own sex, the opposite sex, or to both sexes. Find out more about protected characteristics at equalityhumanrights.com.
So hopefully now you have a further in-depth understanding of the protected characteristics within the Equality Act 2010. So equality, what does that mean? It means treating every person fairly, valuing every person, supporting people's rights, providing every person with access to the same life opportunities as everyone else. For example, making informed information about health and social care services that are available in a variety of languages and formats. Diversity. This means recognizing that every person is unique, recognizing that every person is different, valuing people's differences. For example, a residential care home, finding out about an individual's religious practices and the support that is required to facilitate these. Inclusion. This means being able to contribute to society, being able to participate in society, developing a sense of belonging, and developing a positive sense of well-being. Discrimination. So here are some of the key terms. Discrimination, which is to deny equality to a person based on their characteristics such as race, gender, a disability. Prejudice, this comes from the term prejudge and is unfavorable opinion or feeling a feeling formed beforehand or without knowledge, a thought or reason. Stereotype, this is the forming of a decision about someone or something based on often incorrect and incomplete information you have about them. Race, that's the belief that characteristics such as skin color makes one race superior to another. Sexual, the belief that a person's gender makes them superior to the other. Disability, the belief that someone with a disability cannot or should not do or have the same opportunities as a non disabled person. Age, the belief that someone of a particular age is unable to do something or should be denied an opportunity purely because of their age. We have direct and also indirect discrimination that can take place. An example of this is maybe a young girl is denied, or a girl, should I say, is denied the opportunity to study woodwork because the class is full of males. Indirect discrimination is less easy to see, so this could be a setting that chooses to hold a relative's event on a Friday afternoon, which excludes those that have religious observations on that day from taking part. Effects of discrimination, this could be due to health problems. So, some of the effects that can impact an individual can be stress leading to physical illness. You could have fear that builds feelings of insecurity or not being safe. Emotionally, where the individual is feeling inferior, may have low self-esteem, and that they do not belong, and this can reinforce stereotypes, thereby creating a cycle of discrimination. Discrimination, which takes place in the form of low expectations about a person because of a preconceived belief or what they are capable of, will eventually affect the person's achievements. It is important, therefore, to ensure that all individuals are given the same opportunities and that staff have high expectations of every individual that they come into contact with. The Care Quality Commission's Essential Standards of Quality and Safety describes good practice in inclusion with individuals as discussing information about choices in a way that they can understand, providing information about what their rights are, having staff who are aware of and understand and recognize the person's social and cultural diversity, their values and beliefs, that they may influence their decisions and how they want to receive care, treatment, and support. This is so that people who use services receive care, treatment, and support that is provided in a way that ensures that their human rights and diversity are respected. Discrimination, this means the unfair treatment of individuals or groups, the unequal treatment of an individual or groups, and it applies to everyone. Discrimination behaviors is what we see and what we hear. So, and we can learn from these experiences. We can also learn more about different cultures, which ensures that we can also treat individuals respectfully. Now we're going to look at some of the acts. So the Human Rights Act 1998, which is based on the rights to respect for private and family life, the right not to be tortured or treated in an inhumane or degrading way, and the right not to be discriminated against. This involves enabling and promoting privacy, respect, dignity, independence, choice, and equality. So, how are these rights promoted? We can do this by providing high quality care that respects the individual's preferences, by also safeguarding individuals from danger, harm, and abuse, and also providing individuals with the care that is required. Examples can be obtaining an individual's permission to provide support with an activity, respecting an individual's rights to change their mind over what they want to eat or read or where to go, and knocking on an individual's bedroom door before entering if you're looking after them in their home environment. Providing individuals with the opportunity to fulfill their capacity, such as reaching their potential by doing as much as possible for themselves when carrying out day to day activities, and enable individuals to build their self confidence by trying a new activity, such as singing or visiting a new place or a new town or learning a new skill, such as cooking. Consider whether your setting does enough to demonstrate its commitment to equality, diversity, and inclusion. Could you do more by identifying training courses you could attend or obtaining posters or other resources? By encouraging colleagues to reflect on the needs and the diversity of the settings in their activities or their plans, or just by being a good role model. Discriminatory statements and behaviours might come from your colleagues and the individuals you work with or their families. And as a practitioner, it is your duty to challenge discrimination and work towards making your setting fairer for all. If you do nothing, you are giving the impression that you agree with it. There's always a time and a place, so challenging someone can cause difficulties, especially if you do this in public. So at times, it may be more appropriate to ask to speak to the person privately. State your concerns clearly and calmly and explain that you find their comments or behavior unacceptable. And if necessary, seek the support of your manager. We can also do this by ensuring that actions of those and others that cause harm and abuse are recorded and reported. As a care practitioner, keeping up to date with current legislative and organisational requirements and best practices is important and it promotes the individual's rights to live safely. As an individual, provide opportunities to when you're working with your clients to make their own choices and providing information in a format that is easily understood to ensure they understand that's available to them and the options that they have in making decisions. We can promote individuals' dignity by applying the practitioner's professional duty of care and complying with health and social care settings agreed ways of working. First, find out from your individuals what these are when it comes to best ways in which they would like to be supported. And remember that every individual will have their own personal view or preferences for their practice that they value and uphold. Take into consideration the individual's culture and beliefs, and also make sure that you yourself take do not impede on their privacy by letting your own cultural or personal beliefs and values influence the individual or the care and support that you provide. When it comes to protecting individuals from danger, harm, and abuse, identify the potential dangers before they occur and put into place controls that reduce or remove the potential risk, i.e., via risk assessment process. Report and record all concerns in line with health and safety and social care settings, agreed ways of working, and refer to both internal and external sources of support and reporting to channels such as whistleblowing. Now, what is whistleblowing? Whistleblowing is a term used when someone who works for an employer raises a concern about malpractice and also any concerns. Now, ideally, such concerns should be dealt with by the employer. However, if the management have not dealt with those concerns by responding appropriately to them, perhaps by using the employer's own whistleblowing policy, or the worker does not feel confident that the management will deal with the concerns properly, they can instead make a disclosure to the prescribed body, such as the regulator like CQC. The Public Interest Disclosure Act 1998 protects workers by providing a remedy if they suffer a workplace reprisal from raising a concern which they believe to be genuine. Disclosures can be about the safety of patients or people who use services, the failure of a provider to comply with the law or the national standards of quality and safety, financial malpractice or risks to staff or other people. If a worker is concerned that vulnerable adults or children used in a service are not being cared for in a way that keeps them safe, they can raise the concern with their local authority, the local council, or under the safeguarding procedures. They can do this as well as whistleblowing to CQC or any other body such as the police. So, how can we provide individual care and support? By enabling the personalization of all care and support provided, and by providing personal centered approaches, by ensuring individual strengths and abilities and preferences are at the base of all care and support provided, and by empowering individuals to gain control over their lives, including the care and support they receive.